Good afternoon, everyone. We are the fourth group to present and we will be discussing about testes. So first, what is a function of the male reproductive system? So it is to produce and supply the sperm. So when we see the external anatomy, we see the penis and the scrotum, which is a sac that houses the testes. So inside the scrotum is the testis, which is the site of sperm production. Most men have two testes. So what are the testes? These are responsible for making testosterone, which is the primary male sex hormone, and for producing the sperm. Within the testes are coiled masses of tubes called seminiferous tubules. These tubules are responsible for producing the sperm cells through a process called spermatogenesis. There are three subdivisions on the function of male reproductive. Number one is spermatogenesis, which is the formation of the sperm. The second is the performance of the male sexual act. The third is the regulation of male reproductive functions by the various hormones. So, associated with these reproductive functions are the effects of male sex hormones on the accessory sexual organs, cellular metabolism, growth, and other functions of the body. What is spermatogenesis? So, it is the origin and development of sperm cells within the male reproductive organs, the testes. So, the sperm cells are produced within that testis in structures called seminiferous tubules. It occurs in the seminiferous tubules during the active sexual life as a result of stimulation by the anterior pituitary gonadotrophic hormones beginning at an average of 13 years and continuing throughout most of the remainder of life, but then decreasing remarkably in old age. So in the first stage of spermatogenesis, the spermatogonia migrate among Sertoli cells toward the central lumen of the seminiferous tubule. The Sertoli cells are large with overflowing cytoplasmic envelopes that surround the developing spermatogonia all the way to the central lumen of the tubule. Spermatogonia. So it is the immature germ cell that is formed when the primordial germ cells migrate into the testis during the formation of the embryo. So it lies in 2 or 3 layers of the inner surfaces of the seminiferous tubules. So it begins to undergo mitotic division beginning at puberty and continually proliferate and differentiate through definite stages of development to form the sperm. So there are several hormones that play essential roles in the spermatogenesis. So these are the testosterone, luteinizing hormone, follicle stimulating hormone, estrogen, and the growth hormone. First hormone is the testosterone, which is secreted by the Leydig cells located in the interstitium of the testis. It is essential for growth and division of the testicular germinal cells, which is the first stage in forming the sperm. The second is the luteinizing hormone, which is secreted by the anterior pituitary gland, which stimulates the Leydig cells to secrete testosterone.
The third hormone is the follicle stimulating hormone. It is also secreted by the anterior pituitary gland, which stimulates the Sertoli cells. Without this stimulation, the conversion of the spermatids to sperm will not occur. The fourth hormone is estrogen. It is formed from testosterone by the Sertoli cells when they are stimulated by follicle stimulating hormone and are probably also essential for spermiogenesis. The fifth hormone is the growth hormone. It is necessary for controlling background metabolic functions of the testes. It specifically promotes early division of the spermatogonia themselves. In its absence, as in pituitary dwarfs, spermatogenesis is severely deficient or absent, thus causing infertility. Abnormal spermatogenesis and male fertility. The seminiferous tubular epithelium can be destroyed by a number of diseases, like bilateral orchitis. It is an inflammation of the testes resulting from mumps, which causes sterility in some affected males. Degenerate tubular epithelia. Some male infants are born with it as a result of strictures in the genital ducts or other abnormalities. Excessive temperature of the testes. It is another cause of sterility. It is usually temporary. It can be prevented on cold days. Scrotal reflexes cause the musculature of the scrotum to contract, pulling the testes close to the body to maintain this 2 degrees Celsius differential. The effect of temperature on spermatogenesis is increasing the temperature of the testes. With this, the scrotum acts as a cooling mechanism for the testes, without which spermatogenesis might be deficient during hot weather. It has often been stated that the reason the testes are located in the dangling scrotum is to maintain the temperature of these glands. Oh, did you know that the testes are 5 degrees colder than the rest of the body?
Now moving on to the endocrine function of the testis, and we'll also be talking about its physiological action. The endocrine function of the testis is the production of testosterone, which is secreted by the Leydig interstitial cells, as seen in this image. Now, the testicular endocrine function is critical during fetal life, early infancy, and adolescence, as it is responsible for the transition from childhood to adulthood. Now, what are androgens? Androgens are a group of male sex hormones that include testosterone, dihydrotestosterone, and androstenedione, which are all secreted by the testes. Among the 3 androgens, testosterone is secreted in large quantities. However, dihydrotestosterone is the most active one, and the androstenedione is just a precursor of testosterone and other androgens. Now we'll be talking about how these androgens are secreted in the body. The word androgen refers to any steroid hormone with masculinizing effects, such as testosterone, as well as male sex hormones developed outside the testes. The adrenal glands, for example, secrete at least 5 androgens, but their overall masculinizing activity is usually low, around 5% of the total in an adult male, that they do not cause significant masculine characteristics in women, aside from causing pubic and axillary hair development. However, if an adrenal tumor of the androgen producing cells develop, the amount of androgen hormones produced could be sufficient to induce all of the typical male secondary sexual characteristics. Now moving on to how the testosterone functions during fetal development. About 7th week of embryonic development, the male fetal testes begin to produce testosterone. The male chromosome has the SRY, or sex-determining region Y gene, which encodes a protein called the testis-determining factor, which is one of the main functional variations between the female and male sex chromosomes, also called the SRY protein. The SRY protein initiates a cascade of gene activations that cause the genital ridge cells to differentiate into cells that secrete testosterone, and eventually become the testes, whereas the female chromosome causes this ridge to differentiate into cells that secrete estrogens. Removal of the testes in the early male fetus causes development of female sexual organs. Thus, testosterone secreted first by the genital ridges and later by the fetal testes is responsible for the development of the male body characteristics, including the formation of the penis and a scrotum rather than the formation of a clitoris and a vagina. Lastly, it causes formation of the prostate gland, seminal vesicles, and male genital ducts, while at the same time suppressing the formation of female genital organs. So that is the function of the testosterone during fetal development. Thank you.
Next is the effect of testosterone to cause descent of the testes. Testicular descent occurs as a result of the secretion of large quantities of testosterone from the testes. During this sensation, the testis is usually descent into the scrotum. This occurs during the last 2 to 3 months of gestation. So what will happen if a male child is born with undescended but normal testes? If a child is born with this condition, administration of testosterone usually causes the testes to descend in a usual manner if the inguinal canal are large enough. Next is the effect of testosterone on development of adult primary and secondary sexual characteristics. After puberty, increasing amounts of testosterone secretion cause the penis, scrotum, and testes to enlarge about 8/4 before the age of 20 years. Furthermore, it will cause the development of secondary sexual characteristics of the males, beginning at puberty and ending at maturity. These secondary sexual characteristics, in addition to the sexual organs themselves, distinguish the males from the females. First off is the effect on the distribution of body hair. Testosterone causes growth of hair in various places. Examples of this are facial hair, chest hair, and less often in other regions of the body such as the back. It also causes the hair on most portion of the body to become more prolific. Next is baldness. While baldness can be due to aging, low levels of testosterone can also play a part, for it decreases the growth of hair on the top of the head. Another is the effect on the voice. Testosterone secreted by the testes or injected into the body causes hypertrophy of the laryngeal mucosa and enlargement of the larynx. The effect causes at first a relatively discordant, cracking voice, but this gradually changes into a typical adult masculine voice. Next, testosterone increases thickness of the skin and can contribute to the development of acne. Testosterone increases the thickness of the skin over the entire body and increases the ruggedness of the subcutaneous tissue. Furthermore, it increases the rate of secretion by some or perhaps all the body's sebaceous glands, especially on the face, for this can result in acne, which is one of the most common features of male adolescents. Next is testosterone increases protein formation and muscle development. One of the most important male characteristics is the development of increasing musculature after puberty, averaging about 50% in increase in muscle mass over that of a female. This is associated with the increased protein in the non-muscle parts of the body as well. Due to the great effect of testosterone and other androgens have on the body musculature, synthetic androgens have been widely used by athletes to improve their muscular performance, and also in old age as a youth hormone. Next, testosterone increases bone matrix and causes calcium retention. After the great increase in circulating testosterone that occurs at puberty, the bone grows considerably thicker and deposits considerable additional calcium salts. Thus, testosterone increases the total quantity of bone matrix and causes calcium retention. The increase in bone matrix is believed to result from the general protein anabolic function of testosterone. Next, testosterone increases basal metabolic rate. Testosterone secreted by the testes during adolescence and early adult life increases the rate of metabolism from 5 to 10%. This increased rate of metabolism is possibly an indirect result of the effect of testosterone on protein anabolism, the increased quantity of protein, and the enzyme especially increasing the activities of all cells. Next, testosterone increases red blood cells. And lastly, its effect on electrolyte and water balance. Many steroid hormones can increase the reabsorption of sodium in the distal tubules of the kidney, but testosterone also has such an effect, but only in a minor degree. Nevertheless, after puberty, the blood and extracellular fluid volumes of male in relation to the body weight increases as much as 5 to 10%.
Let's talk about the hormonal regulation of the male reproductive system. Hormones are part of the endocrine system. There are many hormones that act on the reproductive system that stimulate, for example, gamete production, sex drive, etc. We begin the journey of the male reproductive hormones in the brain Here, we are looking at the part of the diencephalon of the brain. Here is the hypothalamus, and here we have the pituitary glands consisting of the anterior and posterior pituitary. We are focusing on the anterior pituitary because it is the anterior pituitary which secretes hormones that function in the reproductive system. The anterior pituitary has blood vessels connecting the hypothalamus, the anterior pituitary, and the rest of the body. What happens is that the hypothalamus will secrete gonadotropin releasing hormone or GnRH. This will travel to the anterior pituitary via the blood vessel, the portal blood, and then which the good editor releasing hormone will then stimulate the anterior pituitary to secrete two important hormones. These are the lucid LH or luteinizing hormone and FSH follicle stimulating hormone, so two important hormones secreted by the anterior pituitary. These two hormones, LH and FSH, have separate functions. They will, however, travel to the male testes via the bloodstream. So here, we have the male testes, the seminiferous tubules, which then forms a long tube, essentially, which will connect the urethra penis. The LH and FSH that were secreted by the anterior pituitary will travel to the testes here via the blood vessels. Let us zoom into the testes. This section here known as the seminiferous tubules. The section that we just zoom into is a seminiferous tubule. It is the tubule, but surrounding the seminiferous tubule we have the interstitial space where the capillaries are found, blood vessels as well. Now, the LH and FSH luteinizing hormone and follicle stimulating hormone will enter the interstitial space, and let's see what else we find in this area. Well, within the interstitial space, there are many cells known as the Leydig cells or interstitial cells because they're firing the interstitial space and within the seminiferous tubules. We find Sertoli cells or nerve cells, and it is within the seminiferous tubule region where we find also the spermatogonia. The spermatogonia is a male germ cell that will eventually become sperm as we know, but it can't do that yet without the help of the surrounding cells. So the Sertoli cells and Leydig cells let us focus on the luteinizing hormone first, LH. So luteinizing hormone will enter the interstitial space and it will target the Leydig cells, which will cause the Leydig cells to secrete testosterone. So here the Leydig cells secrete the hormone testosterone. The testosterone is a male hormone. It is the most important antigen. It does a lot of things. This hormone first you can target and stimulate the Sertoli cells, which we'll talk about later, and testosterone has many other effects in the body. So let's look at some of the peripheral effects of testosterone. Firstly, testosterone helps men maintain libido, so sexual function and sexual drive. The testosterone also stimulates bone growth and muscle growth. Testosterone also helps maintain male secondary characteristics such as having a beard and a deep voice. Finally, testosterone is important in the maintenance of accessory glands and organs of the male reproductive system, so the prostate, for example. Therefore, testosterone is definitely important for men. Of course, producing too much testosterone is not good, and so there's a negative feedback occurring when there's a high level of testosterone. So when testosterone level or dihydroxytestosterone levels are high, this will send a negative feedback to the anterior pituitary to inhibit the releasing of luteinizing hormone LH. Because remember, LH was one that stimulated testosterone secretion in the first place. So high testosterone levels will inhibit the release of luteinizing hormone, which should decrease the secretion of testosterone by deleting cells. Now, going back, remember how I told you that testosterone also affects Sertoli cells as well within a similar force tubule? Well, it turns out that the follicle stimulating hormone FSH also targets the Sertoli cells. So, follicle stimulating hormone targets Sertoli cells stimulating on ABP release by the Sertoli cells. So, what is ABP? Well, first, in order for Sertoli cells to secrete ABP, which means androgen binding protein, it needs both follicle stimulating hormone stimulation as well as testosterone being present. So, what does antigen binding protein do? Well, interestingly, Enofit basically stimulates and promotes the synthesis of spermatozoa sperm, which will end up in the lumen of the seminiferous tubule. So androgen binding protein promotes sperm growth, which is spermatogenesis and spermiogenesis. Just to summarize, ABP androgen binding protein will bind to androgen testosterone within the seminiferous tubules, which will in turn will stimulate sperm production basically. So again, two things are required for sperm production, ABP and testosterone. Now, this is Sertoli cells also secrete a hormone called inhibin. Inhibin, as the name suggests, inhibits something, and it acts as a negative feedback signal to the anterior pituitary and hypothalamus area. Inhibin will essentially decrease pituitary production of follicle stimulating hormone. FSH, this is to control and regulate sperm production because we don't want too much sperm. And I hope you enjoyed this video on the regulation of the male hormones and the effects of hormones have on the male reproductive system.